My name is Arthur Nguyen and I'm a fourth-year medical student at the University of Minnesota. I'm pleased to discuss our work on reducing time to imaging for elderly patients presenting with head trauma using clinical decision support. Traumatic brain injury, or TBI, is a leading cause of trauma-related admissions in elderly patients. Current trauma activation criteria are aimed at delivering rapid therapies to patients presenting with life-threatening injuries. However, those without obvious signs of neurological deficits are under triaged. In particular, presenting symptoms of head trauma in older patients 70 years or more don't always reflect the severity of their injuries. Through a multidisciplinary task force, we developed and implemented an emergency department head CT protocol coupled with clinical decision support to facilitate the rapid imaging of older patients aged 70 years or more receiving anticoagulation. Our pathway begins with these patients presenting with signs concerning for head trauma. These patients not meeting full or partial trauma activation criteria receive the STAT head CT, followed by STAT PTT, INR, and CBC. The clinical decision support flags CT orders originating from the protocol to prioritize their completion. Following protocol implementation, we found a significant decrease in time to head CT by over 50%. Nearly 20% of older patients on anticoagulation with suspected head trauma had a positive head CT. 75% of them having a normal GCS of greater than 13. Patients receiving earlier imaging also had a significant reduction in hospital length of stay. Our findings support the use of clinical decision support systems with a multidisciplinary task force to target a reduction in overall time to imaging and better guide the rapid triage and delivery of life-saving interventions to older patients presenting to the ED with signs of head trauma. Thank you.